So in this video I'm going to talk about osteology of the spine and basically the vertebrae. So the spinal column is made up of 7 cervical, 12 thoracic, 5 lumbar, and there's 5 sacral that are fused and 4 coccygeal that are fused. So there's what we call kind of the typical vertebrae. So this is actually a thoracic vertebrae. The body is the large kind of anterior part. That would be over in here, and that would be here. There's the pedicles, which are here. There's the lamina, which is here. There's the transverse processes, which come out to the side. And then there's the spinous processes that come out the back. So here, the spinous processes are the part that actually kind of sticks out, and the transverse processes are here. So this is, like I said, a typical thoracic vertebrae. These guys up here are what we call the articular facets, here and here, down here. These are the superior, and these are the inferior. All right. So there's 2 joints of the spine. There's the inner body joint that is between the bodies and the discs, and then there's what we call the apophyseal joints. And the apophyseal joints are where the facets meet. So this is 2 thoracic vertebrae together. There's an inferior facet meeting with the superior facet, right? And that's what you have up and down the spine. Those articular facets articulating with each other, and that's the apophyseal joints. In terms of the range of motion and the mobility of the spine, that comes from the apophyseal joints, not the inner body joints. All right, the inner body joints, there's a little bit of movement there, but not a lot. The majority of movement is all at the apophyseal joints. And in fact, the position of the articular facets can give you a clue to what kind of mobility is available at that part of the spine. So for example, so now I'm going to talk about the different vertebrae. So the cervical vertebrae, this is a typical cervical vertebrae. You notice that it's got kind of a flat, generally the bodies of the cervical vertebrae, they're kind of flat and smaller. There's what we call the unicate processes, which are these guys kind of sticking out. These are the superior articular facets, and these are the inferior articular facets. There's a hole on the side here. That's the transverse foramen for the vertebral artery. And then the big hole in the middle, which I didn't mention before, that's going to be the vertebral, not the vertebral, the foramen for the spinal cord. Okay, so the spinal cord is going to go down the middle, but this hole on the side is for the vertebral artery. And then you have the spinous processes in the cervical vertebrae, are what they call bifid, so there's kind of 2 of them. Overall, it's kind of smaller and thinner than the other vertebrae. And it's got the articular facets are kind of positioned like shingles, kind of like this, kind of in all 3 planes, and your cervical vertebrae are the most mobile of the vertebrae. This is a typical thoracic vertebrae. It's kind of the one I showed you before. So you notice by comparison, and these are different models, but still, you can see how the body is a lot thicker and a lot rounder. You can see how the spinous processes, in this one they're more straight out, but typically, if you look over here, they're sloping downward in the thoracic spine. And then the articular facets, you notice, at the thoracic spine are straight up in the frontal plane, kind of like windshield wipers, right? So you should notice, and when you're looking at vertebrae, things you generally look at are kind of the bodies and then the articular facets. So you can see how the articular facets of the cervical vertebrae are quite different than the thoracic vertebrae, right? Very different position. The lumbar vertebrae, you can see right away, have the thickest bodies, which would make sense because the farther down you go with the spinal column, the more weight that's being taken, right? So as you go down, there's more weight. So those bodies are much thicker, they're much wider. The spinous processes are more stout and kind of stick out more. The foramen for the spinal cord now is quite a bit smaller. If you compare the size, it's quite a bit different. Okay, this is a smaller model, but still. And again, the spinal cord is going to be thickest up in here, and then as it gets down to the lumbar, it's actually going to kind of dissipate into the cauda equina. So it should make sense that it's a lot smaller in here. The articular facets in the lumbar vertebrae are orientated in the sagittal plane, so kind of like this. And that's for the lumbar spine. Okay, and actually the lumbar spine, you do have a favoring of flexion and extension. There's 2 very important, what they call atypical vertebrae of the cervical spine, and that is the atlas and the axis. The atlas is the very first cervical vertebrae, C1. and that articulates with the C2, so it's going to look like that. This is the anterior arch, or the anterior tubercle, I'm sorry. Posterior tubercle, there's the foramen for the vertebral artery. There's the transverse processes. You notice there's a really big space in here because this is the spinal cord coming right off the head, so you need a lot of space in there. So this is the axis. Here's the dens, which is very prominent and sticks out. Here's your articular facets. Here's your spinous process, and it's beginning kind of a bifred kind of thing, and you have the transverse processes here. So in general, when we talk about movement of the spine, like at the cervical column or at the cervical region or thoracic region or the lumbar region, we're talking about the cumulative effect of each set of apophyseal joints. So with one exception, there's really not a lot of range of motion available at any one set of apophyseal joints. It's just a little bit. So when we talk about, for example, the thoracic range of motion, that's a cumulative effect of each one of these joints added together. Same for the lumbar, same for the cervical. So it's a combination of all those. And here's a nice, this is showing you, this is the occiput, this is the axis, and this is the atlas. The red here is the vertebral artery, and then the yellow is the spinal cord, and you can see how the spinal nerves come off of here. Right, so that's the atlas and the axis, and the rest of the spine would come out of there. At the cervical region, you have flexion, at all parts of the spinal column, you have flexion, extension, rotation, and lateral flexion. When we talk about the cervical column, we generally talk about three different things. We talk about the atlanto-occipital joint, which is the articulation between the atlas and the occiput. We talk about the atlanto-axial joint, which is the articulation between the atlas and the axis, and then we talk about the intercervical joints, which is everything else. Okay, so atlanto-occipital joints, the atlas and the occiput, the atlanto-axial joints, the atlas and the axis. So at the atlanto-occipital joint, and that's the occiput and the atlas, you have no rotation. There's no rotation at that joint. There's about 5 degrees of flexion, about 10 degrees of extension, and then there's about 5 degrees of lateral flexion, but there's no rotation at that joint. At the atlanto-axial joint, all right, it's the opposite. There's actually a ton of rotation. So remember I said when we talk about range of motion throughout the spine, it's kind of a cumulative effect of the apophyseal joints. I said with one exception, there's not a lot of range of motion at any particular joint. The one exception is the atlanto-axial joint. So the atlanto-axial joint, there's about 35 degrees of rotation, of axial rotation. So that's actually about half of your total rotation that's available in the cervical spine, so it's a lot. But there's no lateral flexion at the atlanto-axial joint. So a lot of rotation, no lateral flexion. Then there's about 5 degrees of flexion, about 10 degrees of extension. And the rest of the intercervical joints have about 50-some degrees of flexion, about 20 degrees of extension. There's about 35 degrees of rotation and about 35 to 40 degrees of lateral flexion in the rest of the cervical joints. In the thoracic region, even though the articular facets are orientated in the frontal plane, which you think would kind of favor lateral flexion, because of the ribs, there isn't really a lot of lateral flexion. It's about 25 to 30 degrees. There's about 20 to 30 degrees of rotation and about 30 to 35 degrees of flexion and about 20 to 30 degrees of extension. At the lumbar spine, there's mostly flexion and extension. So like 55 to 60 degrees of flexion and about 20 to 40 degrees of extension. And then there's only about 20 degrees of lateral flexion and only about 5 degrees of rotation. So there's very little rotation at the lumbar spine. This is something to think about when you're doing a rotation with a patient. If you want them to make sure they're really rotating their spine, you want to keep their pelvis still, and they're going to rotate over their pelvis. When I do this, I am rotating my spine, but I'm really internally, externally rotating at my hips. Okay, so kind of that what seems like a lower back rotation, that's really your hips. At your lumbar spine, there's very little actual rotation. And that's range of motion and some osteology of the spine.